Welcome to the April webinar for 2021 for the Digital Medicine Society, or DIME. We've got a very exciting program today where we're talking with current Presidential Innovation Fellows about their experience, about the program itself, and their ways for anyone to get involved. So give me one moment here. All right, so as we can see here, we have a fantastic group of current Presidential Innovation Fellows who will be giving us more information about their experience. And we'll get to them in just a moment, but before we get started, of course, we have to handle some super fun housekeeping. So first and foremost, do remember that today's event is being recorded, and the slides and the recording will be made available on our website afterwards for anyone to check out. And also, what's the most fun about our live events is the Q&A function. My favorite is whenever these become kind of a Wild West and we get really great questions from the audience. So anyone is welcome to ask questions to anyone on the panel or to the entire panel. To do so, please be sure to raise your hand in the participant window, and I can call on you and unmute you for you to ask your question live. Or of course, you're also welcome to drop your questions in the chat box or in the Q&A function. We've got some people who are looking specifically for great questions in the chat box, especially from Marissa Levine, who is a person who is helping support the entire Presidential Innovation Fellows. So we've got you covered on all kinds of questions. But before we jump into the content of today, let's take a step back and learn who we are speaking with today. So I will call on each one of our panelists to do a quick self-introduction before we jump into the content. And we'll just go right in order here on the line. Whoop, that's a really sensitive mouse. All right, so we'll go ahead and get started. Arunan, would you mind starting?
Hi, everyone. Good to meet you. My name is Arunan Skandaraja. I'm a fellow that started this past fall in October, so hard to believe we're halfway through the first year. I'm on detail to the Food and Drug Administration, and my background is in kind of biomedical sciences, came through as a PhD in bioengineering, worked on point-of-care diagnostics for global health, and found that oftentimes working on the technology alone wasn't enough to get to the type of impact I was interested in. So the rest of my journey, including my time here, is sort of that progression to understand what does it take to translate medical innovation out into the field, spent some time in consulting, seeing the business decision making, and was most recently at the Bill and Melinda Gates Foundation, where I helped run programs and provide grants in the digital health and mobile health space. So at the FDA, at a really high level, I'm helping kind of drive their AI strategy, making sure that as they think about operationalizing AI, things like inspections, decision-making around how to dedicate resources, they take a thoughtful approach that learns from all the things that have already been learned in industry and academia. So that's me.
Thanks so much for that. Krishna, do you mind?
Yes. Hi, everybody. My name is Krishna Jularu, and I'm a Presidential Innovation Fellow being detailed to the NIH, and one of the institutes at the NIH is the National Institute of Biomedical Imaging and Bioengineering, which is the NIBIB. So I'm a physician by background. I've completed my residency training, and I was a practicing radiologist. But my background also includes a background in health informatics, and I was the director of radiology informatics at Memorial Sloan Kettering Cancer Center in New York City. Our job was both to manage clinical operations and also research operations. So in the big scheme of things, what is informatics? It is, in the world of healthcare informatics, it's a large part of it is connecting healthcare information together. So when I applied to PIF, they were looking for somebody with some of this background, particularly for the digital healthcare piece of connecting at-home and point-of-care COVID tests to downstream public health and other systems. And that's the nature of the project that I'm working on right now. Thank you.
Awesome, thank you. And Michelle.
Hi, everybody. I'm Michelle Holko. My technical background is in genomics and bioinformatics. I have a PhD in genetics, but quickly kind of moved into the computational bioinformatics space for my postdoctoral fellowship. And then for a while, I was in the private sector after academia. And part of that time, I was working with DARPA in the Prevent the Next Pandemic portfolio, which involved a lot of wearables, a lot of biomarkers. And so I have a strong interest in the biodefense field as well. I am in my second year of PIF, so I joined before the pandemic in October of 2019. And so for my first year as a PIF, I was actually detailed to the NIH as well. I was working with the All of Us research program, which is a precision medicine cohort. The goal is to enroll 1 million diverse Americans across the country and to combine all of their electronic health record data, survey data, demographic data, also wearables data. So I was specifically working on the wearables data piece of that. And I'm happy to report that those Fitbit data on 9,000 diverse Americans have been packaged and are now available to the wide range of researchers in the researcher workbench. So if you have any questions about that, feel free to ping me about that. But then, I decided to stay on to PIF for a second year. And I decided to switch agencies just to kind of diversify my experience. And that's one of for me, the highlights of the PIF program, which we'll go into a little bit more later. But so I'm now currently working, I previously worked with BARDA when the pandemic started, and then I'm currently working with Department of Homeland Security, CISA, the Cybersecurity and Infrastructure Security Agency, on an interagency effort around healthcare and public health cybersecurity, as well as cybersecurity for the biotechnology sector. And then I'm also in a very part-time capacity working with the Department of Defense in the Chem Biodefense program. So happy to be here today and answer anybody's questions.
Fantastic. All right. And last but certainly not least is Janine, who is also a good friend of Dime. Janine, do you mind giving an introduction?
Sure. So I am a first-year PIF working with BARDA Drive. Drive stands for Division of Research, Innovation, and Ventures. I am focusing on emerging biological threats, specifically in cybersecurity. And as part of my background, I have done 16 years working in the New York City hospitals, specifically on the electronic medical records with IoT-connected devices. As a builder and a security researcher, my educational background is in biomedical and health informatics, translational medicine.
Absolutely, yeah, come on in.
And I am also
working there. Go ahead.
And I'm also working on another master's, because I clearly have a lot of time, right? On international affairs, specifically in warfare. And I am the executive director of the Biohacking Village at DEF CON, which focuses on biosecurity, biotechnology, DIY bio, and citizen science.
Fantastic. Thanks everyone for that fantastic introduction. If there's one thing I love about the government, it is the acronyms. So thank you for indulging me. All right, so let's go ahead and get started to today's presentation. I think Michelle, you're the one who is largely kicking us off.
That's right. So first, just to kind of set the stage, I'm going to give you a little bit of background about the PIF program, and then we can kind of delve into questions of all of the panelists. So the Presidential Innovation Fellows, or PIF program, is a federal fellowship program. It's currently run out of TTS at GSA, which is the Technology Transformation Services at the General Services Administration, which is an agency that I personally had no idea what they did before coming to the PIF program. It was actually previously housed under the Office of Science and Technology Policy at the White House. But in the next slide, I'll go into a little bit more detail about why that happened. So the goal of the program, and it's distinct from a lot of the other, there are a lot of fellowship programs within the federal government. One of the most commonly known is the Presidential Management Fellows, PMF. And it's distinct from that largely because instead of recruiting fellows who are kind of earlier in their career, we're actually recruiting fellows from private industry that have established careers, they're mid to late career, they're already experts at what they're doing, to come into government and do a quote unquote civic tour of duty, and to kind of give back to the program and to the country. So we are brought in at a GS-15 level, which is important if you understand the pay scale and the kind of hierarchy of government hiring. It's kind of the highest that you can get without being a senior executive or a political appointee. So we're brought in at a leadership level. The salary is the same for every PIF. It is not negotiable. It's $144,000 a year. And then from our home at GSA, we're able to embed as detailees in specific agencies to do a specific project. So the PIF leadership program is hard at work pretty much all of the time, figuring out what those projects are going to look like, They work with senior leaders at all of the various agencies to figure out, what are the technology problems that need to be tackled, and who could really use this kind of innovative thinking and an injection of PIF in their program. On the next slide, just a little bit about the history of the program. It was founded during the Obama administration by then CTO Todd Park. And really one of the first things that the PIF did was functioned as a SWAT team to address the healthcare.gov crisis. And so that was kind of the claim to fame. They've done a lot of other things since then, including the Blue Button Initiative. But one of the most important things to note is that in 2015, or actually 2017, the PIF program was codified into law via the Talent Act. And this was actually the very last piece of legislation that Obama signed on Trump's inauguration day. And part of the goal of this was to protect the PIF from the changing of administrations. So that was what precipitated the move from OSTP to GSA TTS to kind of act as that buffer and that little bit of protection. And then as of 2021, or now, our cohort numbers are, we have 62 PIFs across 25 agencies. We also have a history of working with 45 agencies to date, so it's quite wide, and the range of projects are very wide also. Next slide. So just a little bit of the impact. So the number on the bottom right is the one that I can speak to directly, the All of Us Research wearables data on about over 9,000 Americans, diverse Americans from across the country. But if you start from the top left, we have recruited over 190 plus top technologists into government. 150 million plus patients can now access their medical data using the Blue Button Initiative, which is also a PIF initiative. $27 million plus cost savings for Veterans Employment Center, and 17 times more digital benefits applications from veterans processed 3 to 5 faster, which is amazing. And you can read some of the other things, and we're happy to provide these slides afterwards. Next slide. So a little bit about our fellows. So we are a very diverse group. I can say that I have never in my career worked with a more diverse group of individuals. And I think that's one of our superpowers. PIFs have a few superpowers, and that is definitely one of them. So we recruit experts who are experts in data analytics and AI, software engineering, DevOps, cloud infrastructure, as well as design, including customer experience, as well as human-centered design and systems design. We also recruit experts in product and product management, and this is distinct from program and project management, but product management, as well as digital strategy, basically entrepreneurship, corporate innovation, and other specialized skill sets. And really, the PIFs that are recruited, you not only want to recruit folks that are technically very sound, but also are going to be able to navigate the very complex way that is the federal government, right? There can be bureaucracy, there can be, layers of hierarchy, and it's really important to have those other kinds of skills like empathy and leadership to help guide you through it. And we also are very focused on creating an inclusive environment, and I think that is just a testament to, really our commitment to diversity on all levels. Next slide. Yeah, so basically, part of the reason for doing this panel discussion today is because we would like you to apply and consider applying. Applications are open until May 14th. You can go to apply.pif.gov. You can also go to pif.gov to just kind of peruse around and look at what some of the other PIFs look like, what some of the projects look like. One of the things to note is that this year for applications, we are asking folks to align themselves to a specific track. So the tracks are the things that I had just delineated on the previous slide, the data analytics, et cetera. And so although you would align to a specific track and that's how you would apply, that doesn't mean that you would only be pigeonholed into projects that are also aligned with that specific track. So once you apply, just identify with the track that's most relevant to you personally. And then once you're, going through the interview process and you have the opportunity to look at the projects, pretty much all of them will be open up to you. And I think that's it. Do we have any other slides?
Not for the presentation. So thank you for driving us through. Yeah, thanks for bringing us through that really fantastic overview. And I'm also seeing here that there's more information in the chat too that's coming through. So be sure to take a look at that chat. And so the application website is on there, the apply.pif.gov. Love these acronyms. It's also written on there. And also there, Michelle mentioned that there are tracks currently that are being recruited for. And those tracks, just really quickly, as was dropped in the chat, are AI, data and analytics, product, design and experience, digital strategy, software, and infrastructure. But of course, you're not going to be necessarily pigeonholed to that, just kind of an idea of the kind of tracks that are being recruited for. So fantastic. Thanks again, Michelle, for the presentation. Very interesting things. And I've got some questions for some of you guys about not only your experience, but what also drove you to apply for this. So I think a great way to kind of talk about it is to maybe share kind of the greatest hits, the things that you're most proud of that you've done with your time here as a PIF. Michelle, you just kicked us off. So let me start off with you about what are the kinds of things that you've done here with your time as a PIF that you have been very excited for?
Oh, that's a great question. I am so proud of the work that I did with the All of Us research program. I can't say enough about that experience, and actually taking it from, data, not even on servers, data, from people's individual PIPs, bringing it together and then packaging that and making that available to the research community. I'm tremendously proud of that. The other thing, because I'm a little bit early on in my current projects at my newer agencies, but the other thing that I'm tremendously proud of is one of the things that was started before I became a PIF, but that I've been helping to shepherd along for about the last 8-9 months, is this Digital Health Council. So one of the things that's unique to PIF is that oftentimes when you come into federal government, you're just kind of in one swim lane, right? You work for one agency, you have one function, and you're kind of supposed to stay in that function. But one of the great things about being a PIF is that you can also do special projects that are outside of your current agency with another agency or with other PIFs. And so a bunch of PIFs, again, before my time, got together and decided that digital health was really something that needed innovation and it needed attention. And it was also cross-cutting across many different agencies within the federal government. So we convene, a federal working group that's called the Digital Health Council once a month to talk about those issues. So we kind of got revived again around COVID, especially about remote monitoring for COVID and other types of remote monitoring applications. There are other types of efforts around rural health. So it's just a really exciting time to be working at that interagency level.
Fantastic. Janine, what are some exciting things that you have been kind of working on and maybe that you've learned from your time so far at PIF?
So I am currently working on the biosecurity side of Drive, and traditionally biosecurity in the way that the World Health Organization defines it. It's very agricultural. It's what happens to the grass and the cows, et cetera, et cetera. And there's a transformation for digital biosecurity, which is the security for the medical devices. So I'm bringing that background and knowledge of this is what's new, this is what's upcoming. How do we deter and defer issues that are coming up? How do we engage better across agencies to have better communication, and we can send that out so that everyone can better protect themselves and the patients that we are liable for.
That's exciting. Great background for that. I don't often hear about cows and grass whenever we talk about innovation, but very excited to see the kind of breadth of work that goes on. We've got just a few more questions here too for you all. I'm going to ask this question and I'll start off and give it to Krishna first. And so from your experience here, what would you say are the different kinds of skills and experiences that you brought to the experience here to help create impact at your agencies and also provide support for other members in your cohort?
Yeah, that's a great question. I think one of the things about PIF that Michelle alluded to is that we are coming in as experienced senior level folks. So the people that they're looking for are people that have had some experience in the industry solving problems and maybe coming to government to help share and exchange problems with very talented people in government. And I've been very impressed with the number of people that are bright, intelligent, forward-thinking in government themselves. And the benefit of PIF, it just allows some interchange of ideas from maybe some private sectors that private sector interactions that just haven't happened before. So some of the things that I'm just really excited about is the opportunity to work with government leaders, but also across agencies, and the idea of coming in and being able to ask kind of basic questions, and being able to connect industry leaders and different agencies in ways that maybe people embedded in a certain agency could not have done so easily, is I think one of the benefits that we've had the opportunity to participate in. So, I just bring in some background in digital healthcare, working with people that, like I said, that are very bright, but just having a novel perspective to it all has been very beneficial.
Great. Thanks for that, Krishna. Arunan, same question for you. What skills and experiences have allowed you to create impact at your agency?
Sure. I mean, just to build on what the rest of the fellows are saying, I think what has really made me feel both successful and impactful is a combination of the soft skills and the hard skills. So coming at the level that you come in, and I have seen this from other fellows, you may hit the ground and really be coding or diving in to do prototypes. I think I came in from a slightly different angle, which is seeing a range of organizations that have launched AI products, that have tried to use digital capabilities to extend access to healthcare, and then coming into the Food and Drug Administration, which regulates those sorts of innovations. I think I bring a pretty interesting lens in terms of, okay, what's the other side? Like when you make an announcement, when you create an enforcement action, how does that actually flow back into the innovation landscape? It's been great to kind of bring that lens. I think the other piece, kind of to the softer element, a lot of my past role, especially at the Gates Foundation, was about convening communities. It's about bringing together people who are thinking about healthcare delivery, using things like community healthcare workers who can provide care in the local community, and bringing those same groups together with the technology developers and with the folks who are thinking about policy. So as Krishna said, we have a lot of flexibility the way we land, to not just land in, for example, the data organization or the digital health organization, but start bridging those groups. And I think that creates some really interesting conversations. And then if you can ground that in some of the experiences we've had being on the innovation side externally, it really can create some interesting conversations. So I think that's been pretty satisfying, and I think a lot of this will actually play out over the course of a couple of years, but it's been nice to see how these conversations have started.
Great, thanks so much for that background. I'm also thinking about everyone on the panelists currently, and then everyone on the line too. I'm sure have had a really fantastic background, but I think the concept of public service might be kind of foreign to some of us. So I'd like to learn the experience from y'all about what has surprised you about your experience in PIF related to public service coming from a healthcare and a digital medicine background. Janine, can I throw you that question first?
I feel like I've been waiting for this question. So yes, what surprised me? So as background, I served in the Marine Corps, and I have worked with a couple of the combatant commands before. This is my official time in the government. And one of the things that surprised me the most is I am big on documentation, right? For a technologist, that shouldn't be a real phrase. It's a juxtaposition, but I enjoy lots of documentation, particularly about failure, because I want to know what didn't work, especially when you're coding something out. You can put in there some comments of, I tried this on this version on this date and it didn't work. I am trying to get folks to invest more in, let's have the conversations about what's working as well as what isn't working so we can move forward.
That's great, thanks. Michelle, Arunan, Krishna, what surprised you about public service?
So, I wasn't actually too surprised. I had worked with government agencies before from the private sector side, but, there is a lot of bureaucracy, and there's a lot more, and I think this happens in the private sector too, in terms of hierarchies and things like that, but you have to learn the organizational culture of each agency, and each agency is so unique. So one of the things that surprises me, but also feels like an opportunity, is that, you know, each government agency, for example, has completely their own onboarding mechanism, right? Their own way of vetting individuals who they're bringing on board to be government employees. So you think government employees are all vetted through the same process. That's actually not true. So even though like we as PIFs had to go through that process for GSA, we then also had to go through that process for every agency we've ever worked with. So you can imagine, gosh, wouldn't that be a really nice place to streamline the use of technology? So that's kind of one of the things that I hope someone tackles. It's definitely outside of my area of expertise, but hopefully someone will take that on.
I think that also is true. Learning culture for anything is important, even for new jobs, not in the public sector. And it also looks like that's how it is too. I'm really interested in that question too about learning from public service. Arunan, can I give you that question next?
Sure. I mean, I think public service has been a learning experience, not just in terms of the surprises that you have around bureaucracy or complexity, but around the long view you're able to take when you're in government. I think oftentimes when you're an innovator or a product developer, it's very important to be focusing on that next quarter or that next year and getting a specific product or a solution out there. I think the mindset I've really enjoyed about being in public service, and I think something I'm hoping to take back if I do go back in the private sector, is that systems view. It's kind of asking the question, how do these pieces fit together? While the agencies might create a little bit of siloing, which I think the fellows are pretty well positioned to help bridge, you still can't take any of these problems in isolation. So if you, for example, are at CMS and thinking about payment, and the question isn't necessarily, which physicians are getting paid what, it's how do you create the systems incentives that drive people to develop new drugs or get new devices out into the field. So I think that sort of systems perspective is something that I've really appreciated. I think the other thing that's kind of been a nice surprise after coming up in the Bay Area on the West Coast is that you can have a very fulfilling, continuous career in a given agency. A lot of the people I respect the most have been at the FDA for 25 years, built multiple teams, changed focus every few years, and really found something pretty meaningful. So I think that's also sometimes a good reminder if you've been in the private sector and are used to changing jobs every couple of years, just you can find that curiosity and that motivation across the breadth of government once you come in.
I really enjoy hearing that. Thanks for that, Arunan. Krishna, your turn. What were some things that you learned about your time here working in public service?
Yeah, I'm gonna maybe go back to also one of your questions about what surprised me, right? And
yeah, surprise me. Go ahead.
Yeah. Well, I was surprised. I was surprised by how receptive people have been to ideas, and I think that there's a really desire in government to do good things for the public benefit. And I think when people come in with some good ideas and some well-intentioned ideas, there was a lot of great reception to it. So somebody like me just coming in from the outside, I felt that I was supported and endorsed, and even working between agencies, I felt a lot of really goodwill, and that was really, really nice to see.
Thanks for sharing that. I think sometimes government gets a bad rap about not being innovative or not being open to things. I personally try not to hold that view. So I'm really glad to hear that from your experience too, working within the government, that you've had a fantastic experience there.
Yeah.
Awesome. Great. So we have a little bit of information about what background you brought, what you've learned so far, but maybe I'd like to ask you guys a little bit of more of these nitty-gritty questions about what do you think a day in the life or a week in the life is like for a PIF? And I'll run down the line too, because it's always good to hear kind of different experiences that folks have to help people in their application process kind of think about what are the interesting and fun things that I could get to. So let me start with that question with Michelle.
Yeah, excellent. And, it's interesting because I can speak to both pre-COVID and so like, quote unquote, normal times, as well as currently. And so what it was like coming in 2019 was a lot of in-person, everything was in person. We have a weekly PIF meeting that, now is virtual, but it's, Wednesday afternoons. And so what most of us would do is we would basically try to block Wednesday off on our schedule and make an effort to be in the co-working space at TPS at GSA downtown, which is right at 1800 F. And so we would, be there together, co-work, grab coffee. It was a great chance to catch up with everybody. Like I said, the PIF colleagues and working with the other PIFs is really wonderful. And sometimes you can get kind of caught up in your agency work and not make time for that. So I definitely did try to take advantage of and make time for that. And then the rest of the time is mostly with your agency. And so that depends on what that looks like. I was actually in a mostly telework situation with NIH from the beginning because they had an issue with the building being condemned. And they were still trying to figure out building space. So we were actually just about to go into a space when COVID hit, and so we were teleworking anyway. So we already had that in place. So that was pretty easy. But for others, I think it was a little bit more challenging to move to that telework posture. And I know that for my colleagues that were working, in the DoD, they still were working in person at the Pentagon. So for example, now the work that I do at the DoD is in person at the Pentagon. Despite the fact that most people are teleworking even from there. So focusing on your agency work, lots of meetings, but also I try to do a lot of like writing and reflecting and actually producing products and things like that. And I'm not actually doing much data analytics myself anymore these days or coding. I'm only doing that on the side because I'm doing a cybersecurity course, I'm trying to be like Janine one day. And so that's pretty much it. Yeah. So who wants to go next?
I think we're all trying to be a little bit like Janine. Janine, why don't you take that question next?
I feel like that's such a loaded request. So day in the life of, so I've been working a lot with BARDA Drive to do the innovation side of their agencies. So again, Division of Research, Innovation, and Ventures. They are also bringing in new devices, new medical devices, and new digital therapies, et cetera, into the government and helping them pay for POCs and getting them manufactured. And then on top of all this, advising them on best practices, current state best practices and future state of best practices for what does manufacturing look like and how to better secure those things and how to get that information out to everyone involved, because I have this this theory that people think the healthcare system that everybody works in is very, very small, and it takes a lot of the breadth and depth of most of the industries actually. And because of that, we have to have bigger conversations with everything for ICS, so industrial control systems, and what the pharmacy looks like. Arunan gave me the word that I do not remember. I keep calling it additives, but the stuff that goes into the medication that makes it active. Where do we get those? How are we procuring them? How are we putting them in at the right dosage, et cetera? So there's a lot of levels that have to go through the discussion so that at the end of this, we can make it right.
Thanks, Janine. You keep mentioning BARDA Drive. Dime did a webinar with BARDA Enact, not Drive, all part of the same family, same but different. So we do have that webinar recording available on our webinar website. It was the event from September 2020. I'll drop that in the chat. But moving along here, Arunan, what's a day in a week in the life, a month in the life of your experience as a PIF?
Sure. So I think the really interesting part about being a PIF is that you do have this time bound. So my months have already shifted quite a bit from the initial phase, which was more about getting to really know a complex organization, a lot of one-on-ones, a lot of introductory conversations to understand priorities. Because we have a little bit of that flexibility in that in the PIF structure, you are really meant to go and understand who is trying to get what done, where there's momentum, where things can be unblocked. So there was a lot of kind of priority gathering, understanding the landscape in those first weeks, months. I think the transition, especially recently, has been to more developing strategy documents, putting together memos, getting feedback offline to figure out where the friction points are, and then presenting at bigger convenings to bring along that bigger audience. And I think one thing that's already started is thinking about transitions as well. Not necessarily because any one of us is leaving, but because we want these projects to have sustainability beyond our time. So that's starting to get involved with conversations around HR. So who are the permanent employees that are going to construct the teams that will really carry on and make real some of the concepts and strategies that we bring in. So it's slowly shifting from discovery, problem definition, a lot of one-on-ones, to more writing, kind of demoing concepts, starting to fold that into things, and actually going as far as talking to our leadership as they think through their HR and their scale-up strategy. So it's kind of been the evolution that I've been going through in my days.
Great. Thanks for that. Krishna.
Yeah, my day-to-day has been actually, of course, we're all remote like everybody else is. And it's been a lot of agency coordination. So, particularly with COVID response, there's multiple different agencies involved. And the idea is that between CDC and the NIH and the Food and Drug Administration and even several private companies and partners, there's been a lot of work in coordinating that effort. And so I've been spending a lot of my time working with standards bodies to decide on what are standards form of communications for health tests. And that requires some buy-in from all these different vendors and partners. So it's been quite the ride so far, and I've really enjoyed it very much.
Great, thanks so much. So we're going to zoom out a little bit from your experience at PIF and have a bit of a broader conversation about just in general innovation in healthcare, and specifically, what does digital medicine mean to you? This is, of course, Digital Medicine Society. I think Krishna, you're on mute. So we'll talk about that for just a little bit. So let's talk about that then. So innovation in healthcare. So what does that mean to you? How has that shaped your career? And maybe how did that kind of guide you to this current step where y'all are in your career at PIF? Let me toss that to, let's go with Michelle.
Yeah, sounds great. So, so there was really one kind of pivotal time in my career that where digital and innovation in healthcare really came in very strongly. Because I grew up in this very academic kind of upbringing in biomedical sciences, and it wasn't really until I was working at DARPA for a good number of years, I think about 5 years, in the biological technologies office. And I was actually working on the Prevent the Next Pandemic portfolio. And we started to, do some research around wearables and how they can potentially contribute to giving an individual more information about their physiological state. One of the challenges, I think, with point measurements, like you go to your doctor's office, you get your heart rate taken, you get your blood pressure taken, is that it's just that, it's just a point measurement. And I see technology as being able to help us get more continuous measurements, so that we're, instead of looking at, absolute values, we're looking at deviations from baseline, and we're learning about each individual's baseline. And I think it's, it's kind of an intuitive concept that we all have our own baselines. And it's just a matter of figuring out when is there a deviation that is significant enough that's going to tip us over into a state of, not healthy or disease. And so I see that as really the intersection where technology is very well poised to help us understand that. And I'm so pleased to see all of the work that's going on in the private sector. I'm also really excited being in government right now and figuring out, how are we going to regulate these types of technologies, right? What is the guidance? How are you going to implement, et cetera? I think that there's a huge white space there, and that's what's really exciting to me.
Thanks for that, Michelle. I think you teed that up really well to go to Arun. Given your current, work now supporting the FDA. So can you tell me more about what innovation in healthcare and digital medicine sort of means to you, and how that has led you to PIF? Sure.
So I think when I was going through my initial training, my schooling, a lot of what drew me to healthcare in general was the discrepancies in healthcare, the differences between access, particularly as an immigrant, what that looked like for my family growing up in Sri Lanka versus what it may look like in a wealthier or less wealthy neighborhood in the US. And that gap led me to focus a lot of my early research on point of care diagnostics, kind of asking the question, if you can shift a diagnostic closer to the person, can you reduce the burden of getting out and making it into a facility? And that fits so tightly with what digital medicine means to me. The ability of digital to move capabilities, both for diagnosis and treatment, out to the people who need it, potentially with less skill. If you have artificial intelligence or you have something else that can be that fallback mechanism. I think what led me to the government was thinking about what that ecosystem looked like for those types of innovations. And in the government, I mean, you can define innovation as simply as like a new way of doing something, right? And ideally, it's a good innovation, something that will create some benefit to that population. I think the government and regulatory agencies play a huge role in funding that type of innovation, in creating the kind of the paradigms that industry follows based on regulation. And getting to be here at that kind of the intersection has been really exciting. They're always kind of asking that question, where can digital not only provide new capabilities, provide further insight, but where can it start closing gaps in access and gaps in inequities? And I think the posture of government's also, I think, really well designed to ask that type of question. So that's what's led me here. I think that's what's keeping me here.
Great, thanks. Yes, I think we all agree that government is kind of well designed to ask these, and we're so glad to have so many great thinkers keeping that kind of top of mind amongst work. I'll toss that same question to Krishna. What does innovation in healthcare and digital medicine mean to you?
Well, what I'm particularly excited about is a transition of healthcare from very traditional models of like hospitals and clinics to a more distributed environment. And I think that's one of the things that we're seeing. So, like I said, I'm working on the COVID response right now, but I'm very well aware that the solutions that we bring and the ideas that we bring are really going to transcend into other parts of healthcare delivery in the United States. So we're really moving to a world where, again, we're getting out of hospital systems, moving to home health, distributed health. And there's so many questions surrounding how is it that we get information from a patient, store it in their own health records, having patients have their own ability to manage their own health systems, and then have their permission and control to share it with who they want. So moving away from a world in which health is managed by somebody in terms of the information, but where the individual patient has more control and then can share that to the outside. I think we're really working towards that world. The COVID response has really helped us rethink that, because we can't go into the hospital as much, that now we have this opportunity to say, what can we do at home and how do we manage that? How do we collect that data and then distribute it? So that's what innovation means to me.
I really like that. Innovation not only makes things better, but helps give more autonomy to patients. I think that's what we're all hoping for here.
Yeah.
Yeah, Janine, last but not least for that question.
So what you see me doing when I look down is that I'm writing. I have books of things. So here's my answer for this, because I had this conversation the other day. Innovation doesn't have a static definition. Is it a brand new development, or is it a new manner of using an existing item? So adaptation, like Arun had said, and then taking this into consideration, how does healthcare evolve from a very conformed state to one of a more agile movement? Innovation also has to take into consideration the society and the people, because current state, I love statistics. So I think it's 60, maybe it's not, maybe it's 36% of the US population will be millennials and retired within the next, I think, 2 to 5 years. So we have to adjust all of our technology, because we are building, but we also have to take into consideration the population that we are building for. So taking those things as part of what we're doing, how are we going to teach people how to learn from this? How are we going to engage the physicians so that they can also teach the people? And digital medicine gets people to open up, or at least it did for me, because we're in each other's homes now, right? So if I'm wearing a device, I don't just have a 1-year checkup and then we check up and I call you and it's a thing. We have longitudinal studies now that can give better care to people, like Krishna had said. And it not only helps with the individual care, it helps with population care, because now you can study, I'm from New York, so this is what I'm going to do, like the projects, right? You can see what's going on in the projects versus what's going on in the suburbs, and help make distinctions for doing more work with a group of people.
Fantastic. This is, I am so glad that all of you are part of this community, because it feels like we're all trying to we're all aligned on how to help innovate healthcare in a way that's really useful, not only just for the technological age that we're in, but also is really useful for the actual people we're trying to study, right? Making people's lives so much better, and not just shoving technology and telling them it'll work for them, but how does this actually work for real people? That's absolutely what we're excited for. So thanks everyone for that response. So we're getting towards the end of our hour here for this webinar. So let's try to focus here on trying to help people decide if PIF is right for them. And so we've talked about the really exciting things that each of you have been able to work on, and we've given the information to learn more about PIF. But what would each of you say to mid to senior career professionals who are still on the fence, maybe determining if PIF is right for them? What would you say to them who are considering to explore PIF as a next step? And I'll throw that right back to Janine.
So I feel like my life has been multiple tours of duty in various capacities. I am a big person of giving back to the people that have done the things for me. And his background, my father is a paramedic. He was at 9/11. He's doing the things. My mother survived one of the worst cancers in the world because she's an overachiever at getting all the things. So how do I contribute to the larger picture of getting technology to change from the top down? It's by being in the government and helping them move forward with the ideas that I have picked up from private sector.
Great, thanks for that. I think that you definitely seem like the daughter of your parents. how much you give back to everyone. Let's see, Ermunin, what would you say to people who are determining whether or not PIF is right for them?
I would say that there's not, while applying for a government job is complicated, this is one of the best ways to think about going through that process. The type of support we get from Marissa and team, the way that they've created a hiring path for us. I think if you are at a position where you feel like you have something to give back and you're curious, how do I want to take a look in government? How do I want to do that tour of duty? As Janine said, there's a lot of ways to serve. But this, I think, is one of the ways where you have the most support and the most sponsorship to go down that path. So it's worth a try. You'll learn a lot more about potential projects in the interview process. You'll have a chance to talk to agency sponsors, understand their priorities. I think that experience alone is kind of worth taking back as you might move on to something else. But if you do have the chance to not only interview, but come into the program, I think it's a way to serve that gives you visibility into a range of problems. It has led to a lot of PIFs that kind of move on to start their own companies, a lot of PIFs that move on to be in leadership roles in government. So I think it's kind of worth the risk, right? It's one of the easiest ways to go through the process of coming into government with the most support and with the kind of visibility that will let you figure out where you want to fit in at the end of the process.
Thanks for that, Aruna. And I think it's great to not only think about the amazing things that you can learn while being a PIF, not only learning the intricacies of the government, what kind of resources you can have as a PIF, but also really positioning you to whatever next phase of your career journey would be after that, whether that's being a founder for something else or to bring this really rich experience into whatever next step. I think it's always good to think about. So it's great to hear the kind of exciting work that PIFs do afterwards, because I'm sure everyone would love to be a PIF for their entire life, but it's got to end at some point and move to the next phase of their career. Let's see, Krishna, let me ask you that question. What would you say to anyone who is maybe listening on the line today or listening to your recording about whether or not PIF is right for them? What kind of advice would you give to people who are trying to decide?
I think for me, the reason that I had applied for PIF is not because I was unhappy in what I was already doing. I was actually happy and I was comfortable and I felt like I was respected for my work. I did it because I wanted to think differently and to tackle problems at a bigger level, at a bigger scale. And that's what I think PIF has allowed me to do. Just coming into government and working with government leaders across agencies and thinking about a problem at a national level has been so eye-opening for me. And I think if anybody else who, even if you're comfortable doing what you're doing, if you want to take some time to think differently and to think at a more national level, I think you should definitely consider looking at PIF.
Thanks for sharing that. I was shared previously on this webinar that part of the experience as being a PIF, if I'm understanding correctly, is the ability to sort of think long-term, sort of long-term systems. And I think often in the private sector, we are very project-based, delivery-based, let's go, let's push this out. But being in the government, you have the ability to kind of think long-term. So if we deploy a project now, how will that affect people, you know, maybe 10 years down the line, not just this product that maybe private sector makes, we're thinking about what it works now, but how does that actually affect people long term? So I think that that's a really great way to kind of think about things a bit differently, maybe not so harried that you have in the private sector, but more long term and kind of nationally. So I really appreciate hearing more about that from you, Krishna. Thanks for that. And Michelle, last but certainly not least, what would you say to folks who are maybe considering applying, or if PIF is right for them?
Well, I would say if you are at all inspired or interested by this conversation or what you see on the website, you should definitely consider applying. You know, if you're kind of on the edge, you can also reach out and ask to talk to someone who's currently a PIF. You know, we're all pretty well on LinkedIn and technology, so feel free to reach out to us. But I would say go for it. Quite honestly, I was on the fence a little bit when I applied. Like Krishna, I was very happy in what I was doing, but I was inspired. I wasn't sure that I was PIF material. Turns out it was a great fit, and I've had a great experience. So, you know, it's going to take all kinds of people with all kinds of backgrounds. And if you're kind of at all on the edge or interested, I would say apply. Just one other thing that I wanted to add that's not really directly related to that question. But to give people a little bit of context to what people do after PIF. You know, this is the kind of role that you come into already thinking about what you're going to do next, because it's such a short time frame, right? And so it's actually interesting to note that almost 50% of people after PIF end up staying in government, and some at even very high levels. So the current CTO of the VA is a PIF, the current Chief Technology Officer of the Veterans Affairs, or the Veterans Administration, is a former PIF. The Director of DIU, the Defense Innovation Unit, is a former PIF. And so, you know, it is definitely possible to stay in government after PIF, not as a PIF, but that requires a lot of coordination. And then about half, you know, end up going back out into the private sector. And it truly is just a kind of a short-term thing. And both of those are fine. One of the great things about the PIF community also is that the alumni network is very strong. And so it's kind of like once a PIF, always a PIF. And we're always able to reach out to PIFs previous to us. And it's nice to think that one day when I'm an alumni, I'll also be able to reach out to PIFs that are currently coming into the program.
I appreciate you sharing that too, Michelle. And since you said it, if people have any questions about the PIF process, of course, we have seen that Marissa Levine has been very helpful answering all kinds of questions. And so I think it's important, if you have any questions with the PIF program, why don't you ask? And then it will help maybe think about application can work. Because Michelle said she wasn't too sure if it was right for her, but it turns out to be fantastic. So she spent some time doing that application and it turned out super great for her. And since she offered, I'm going to go ahead and say it, that if you're on Slack, which Michelle is, do feel free to go ahead and DM her with any kinds of questions. I'm going to apologize in advance, Michelle, if your DMs blow up, but I think it is for all a great cause.
No problem.
Yeah,
no, I'm happy to.
Fantastic. Awesome. Okay. And so we have some more information being dropped in the chat here about how to apply. And there's of course much more information about the specifics of the program. I'm sure you're all wondering some questions about maybe some logistics, such as, do I have to move over there? Things like that. I'm sure there's much more information on the website. And speaking of that website, I'm going to go ahead and share it again right here. So we are also coming to the end of our hour here. So hopefully that's shared, right? Can y'all see that last screen? That's fantastic. Thanks. Okay, so again, May 14th is that application deadline. And if you're like me and you got surprised by April being here, that is about 5 weeks away. So go ahead and jump on that and take a look and see how much time you need to kind of put together your application and to also think about whether or not PIF is right for you. And like Michelle said, she was on the fence, went ahead and applied, and it's been a great experience for her. So thank you all to our fantastic panelists here. So I'll do a little bit of DIME closeout. So thanks for bearing with me. And so we have our next DIME event, which is coming up on April 20th, which is about digital inclusion as a social determinant of health, something that should be important for everyone. And I'm sure it's important for everyone on the line here. And so we're very excited to have Cynthia Seek as the professor who published this paper, which you can access on our website here from the Ohio State University College of Medicine. And then, of course, here, our end of month event here on April 30th is our we are relaunching our playbook, which is the essential industry guide for successful remote monitoring across clinical research, clinical care, and public health. A lot of folks on the line I know have accessed this playbook before. It's available on our website here, but we are doing an update. So this April 30th event is a very exciting update on what we've done so far. So we hope to see you all there to get more information about how we're building, we're collaboratively building great tools for the field. But that's all that we have today. So thank you all for not only joining live, but also very big thanks to our current PIFs, not only for your great work currently as a PIF, but also for joining us today for this really fantastic webinar. So thank you so much from Michelle, Arunan, Krishna, and Janine. We're gonna end just a little bit early to get everyone back on their back-to-back calls and maybe squeeze in a lunch break. So thank you all for joining us today.
Thanks, Rachel. Thanks, everybody.
Bye, thank you.
Thank you.